What diseases affect bird populations? Have you ever wondered how diseases impact our feathered friends? Bird populations face a range of diseases that can threaten their survival. Understanding these diseases is vital for bird conservation efforts. Let's take a closer look at some of the most common diseases affecting birds and how disease surveillance plays a role in protecting them. Avian botulism is a serious concern, especially for waterfowl. This paralytic disease is caused by toxins from the bacterium Clostridium botulinum. Birds often ingest the toxin through contaminated food or water, leading to paralysis and death. Another significant threat is avian influenza, commonly known as bird flu. This viral infection spreads quickly among both wild and domestic birds. It affects the respiratory, digestive, and nervous systems. Some strains can cause high mortality rates in bird populations. Avian cholera, caused by the bacterium Pasteurella unknown, leads to severe outbreaks, particularly in waterfowl during migration. Infected birds shed bacteria in their droppings, contaminating their environment and facilitating the spread of the disease. West Nile virus is another disease that affects many bird species. This mosquito-borne virus often causes neurological disease and can be fatal. Birds are the primary hosts, and mosquitoes transmit the virus between birds and sometimes to humans. Salmonellosis is caused by Salmonella bacteria and affects the digestive system of birds. It can spread through contaminated food and water, leading to diarrhea and even death. Birds can also transmit this disease to humans. Mycoplasmosis is a bacterial infection that causes conjunctivitis and respiratory issues. It spreads rapidly among birds at feeders, weakening individuals and making them more vulnerable to other threats. Avian tuberculosis, caused by Mycobacterium avium, is a chronic disease that spreads through inhalation of dried droppings. It has a long incubation period and can cause respiratory symptoms and weight loss in birds. Newcastle disease is a viral infection that affects the respiratory and nervous systems. While it primarily impacts domestic poultry, wild birds can also be affected. It spreads through contact with infected birds or their droppings. Cryptosporidiosis is a parasitic disease caused by protozoa that infect the digestive tract. It spreads through contaminated water and feces, leading to diarrhea and weakness in birds. Aspergillosis is a fungal infection that occurs when birds inhale spores from moldy environments. It affects the respiratory system and can be fatal, especially in young or immunocompromised birds. Finally, avian trichomonosis is caused by the protozoan Trichomonas gallinae. This disease leads to oral lesions that can block food or air passage, resulting in starvation or suffocation. These diseases can cause direct mortality or weaken birds, making them more susceptible to predators and environmental stress. They often spread more easily when birds gather in large numbers, such as at feeding sites or migratory stopovers. Disease surveillance is essential for bird conservation efforts. Bird banding and tracking programs provide critical data on bird movements, population trends, and health status. Monitoring disease outbreaks helps identify emerging threats and informs management actions. Preventive measures include minimizing a natural congregation of birds, regularly cleaning feeders and baths, and protecting natural habitats. By monitoring and controlling invasive species, we can help reduce the impact of these diseases on bird populations. Understanding these diseases and implementing effective disease surveillance through bird banding and tracking is vital for safeguarding our avian friends. Together, we can work towards healthier bird populations and a brighter future for them.